Mr. Speaker, will you please call the House to order?
The bill is passed.
We'd like to get a budget that represents the interests of the people who are standing here with me now.
To be part of the struggle to achieve a better society for all.
And that's why today I'm very pleased to cast my vote in the affirmative. Thank you.
Hello and welcome to Assembly Update. I'm Liz Koenig. With the onset and long duration of the COVID-19 pandemic, rural communities have been hit hard. Even before the pandemic, many rural communities have faced a lack of high-speed broadband access, short-staffed hospitals, limited access to health care, and now vaccine distribution. Joining us today on the show to talk about some of the work he's doing as chair of the Rural Resources Commission, Assemblyman Angelo Santabarbara, who represents the 111th Assembly District, which includes Montgomery County and parts of Albany and Schenectady counties. Assemblyman, thank you so much for coming in, or actually joining me remotely, to discuss this very, very important topic. I know there's been a lot of concern about the distribution of vaccinations. So thanks for joining us to keep us updated on what's going on.
Again, great to see you again, even if it is through the screen.
Yes.
As you said, it's a topic, and thank you for having me on the show.
Now, so since the beginning of the vaccine rollout, we've experienced a really slow supply distribution. How is this affecting the rural communities that you represent?
Well, as you said, there's just been a slow rollout of the vaccine, much slower than anybody wanted to see, and we're seeing it across the entire country. The numbers are getting better, but they're not where they need to be. For us here in New York, between the state and federal government's management, part of the frustration that I have is there's been little transparency regarding the distribution practices themselves, and very little answers as to why the supply lines are so unpredictable. We're seeing this across the entire state, where we see appointments being made and sometimes being canceled, or there's not enough vaccines available for the people that are requesting them. So there's been a lot of confusion around just the distribution of it, when you can make an appointment, and for that matter, the different categories that have been rolled out, as well as who is even eligible for a vaccine. So I share those frustrations, and my role as chair of the Rural Resources Commission, what I don't want to see is our rural areas be left behind in this, because they do face unique challenges, and you mentioned some of them at the beginning of the show. Just healthcare in general just operates much differently there, and I think we need to be aware of that as we continue to roll out the vaccines.
What are some of the hurdles reaching mass vaccination numbers in these rural areas?
And well, as I just said, I represent Montgomery, rural parts of Albany County. Montgomery County has a very rural section component to it, and even in Schenectady County, some very rural areas. Montgomery County, the last numbers I saw, where we saw around 13% were vaccinated. The other side of it is that we still had over 100 positive COVID cases of people each week since the start of 2021. That's very significant. That just goes to show that how slow it's been with the rollout. But even before the pandemic, the rural communities face limited healthcare access, as you said. And now, really, when we should have an ample supply of vaccines to protect our communities, we're unable to even get that vaccine supply. So that's one challenge that we're facing. But low supply isn't the only hurdle, because to reach the critical mass vaccination numbers, our rural areas face the unique problem, as I just mentioned, of the long distance, the long travel times, and the limited vaccination sites. So we did see not too long ago a few popped up, including where my district office is at Riverfront Center in the city of Amsterdam. Another pop-up vaccination site has been there. I'm suggesting that, we saw a vaccination site at the Washington Armory not too long ago in Albany. I'm suggesting that the state look at places like the Fonda Fairgrounds, where, it could significantly reduce that travel time, where right now people are traveling as far as, Syracuse, other areas that are very far away, even to get to the Washington Armory. To ask someone from Western Montgomery County to get out there, that's a very long distance, and we're in the middle of winter here. We're talking about seniors. We're talking about people who sometimes have limited means of mobility, not really on a bus line. It's very difficult to even get out to a mass vaccination site like that. But what I'm hoping to see is an increase in supply lines soon. But we also need more communication from the state to the counties so we can make sure that those that want a vaccine are able to access one. And a lot has to happen in order for us to really reach that critical mass when we're talking about our rural communities.
And an interesting proposal you have is with EMS services playing a role in vaccine distribution. How would that work?
And that's really what I wanted to talk about because the proposal that I'm working on now is how do we reach people in these rural communities that have limited ability to get to a vaccination site. Throughout this pandemic, I've done a number of food drives. I've worked at the soup kitchen, and often you see people that are picking up food for other people that, again, are homebound seniors or just can't have the means to get to get to a food distribution site. So if we're having challenges with that, and Meals on Wheels is also something in these counties, in the counties I represent, is very important even to get food meals to people on a daily basis. Now, you can imagine trying to get a vaccine. We have to figure out a different way to administer these vaccines in these rural communities. EMS services is something I'm looking at because, especially in rural communities, throughout this pandemic, they've really increased their profile during COVID-19 and their ability to respond, to adopt to new practices, and they've done it fairly easily. The leaders in the ambulance services that are in these areas are also well versed in managing multiple patient incidents. So it's a perfect fit for them to be able to step in and help us out here. The fact is, in our rural communities, I've said this time and time again, so many times, they are the only healthcare service that's even close by to be able to respond. Why wouldn't we include them in a plan to distribute these vaccines to reach that critical mass? I think it makes sense.
But what are the details of this plan? Will the EMS work
Be actually administering the vaccinations?
What is it? There is some things that have to be worked out, and some of it is happening right now. We have to ensure the state and local regulations allow that people that are going to be performing this type of vaccine distributions are approved to do what's called intramuscular injections. So depending on the regulations, if an EMS provider needs to become a vaccine administrator, needs a vaccine coordinator, or even the vaccine storage capacity, we have to think about storing the vaccines because that's been an issue in the past as well. They can work with CDC to figure out how to do that. They've been providing guidance to do that. And most states, in fact, already have an agreement in place.
And how has this been working in other parts of the country?
That's some examples that we can point to right now, and I'm going to be talking about this in my proposal. Is that the Minnesota Commissioner of Health recently signed an order allowing EMTs, AEMTs, and paramedics to be able to administer the COVID vaccine. So it's already happening in some of our neighboring states. The other example I have is in the state of Maine. EMS workers have been able to administer COVID vaccinations, and there's also a financial component here. How we're going to fund all this. How our provider is going to get reimbursed. They've been able to do it, and they've been able to bill for the services. Although they've been able to bill for the services right now, due to supply issues, they haven't been able to really deploy the teams in the capacity that we want to see. But they are certainly standing by and ready to do so. And I hope to see New York in a similar position where when supply lines start to increase, we will have providers that are ready to reach out to these rural communities to start assisting, and it's very much needed in these rural communities. All signs point to people that are just not going to be able to get to these vaccination sites, even though they are available. We hope to make more available. They're just not going to be able to get there. We have to figure out a way. This is a solution to be able to do it, and I hope to see it advance fairly quickly here in the state assembly.
Do you see gaining any support from your colleagues in the state or actually on the federal level at all?
The National EMS Association is working with FEMA. They're working with the Biden administration and others to make sure there's funding for ambulance services to perform these tasks. That's going to be important to make sure that those funds can be accessed so that they can go out and do the work and be reimbursed for it. And I think there's plenty of ambulance services that are willing to do this. Medicare also issued guidance stating that ambulance service can bill for this service, as we saw in the state of Maine, and can be reimbursed for the COVID-19 vaccine administration. So, it seems to be working in some of the other states. Again, supply is always the issue. But at some point, we're going to overcome that. We're going to have the supply. The question is going to be, how do we get it into these hard to reach areas? And that's what we need to start to figure out right now to plan for that. It's a critical component when you think about how many rural communities we have in New York State.
Now, you mentioned storage of the vaccines. I understand the vaccine needs to be kept at a very, very low temperature and needs to be administered very quickly after it's taken out of that storage. So how would this proposal work in New York?
Well, in New York, there's a few things that can happen. EMTs need a provider what's called a provider identifier number to be able to perform the vaccinations. It's also possible for funding to get funding options as a funding option through the use of state FEMA dollars. So they can look at doing that. If public health agencies or a community, kind of Rotterdam or other communities, want rural ambulance service themselves want to be able to do this, they have the ability to do so by applying to become a vaccine administrator or a mass immunizer. So there are options out there. Something that I want to incorporate into my proposal for out-of-profit services. Direct contract services have already been used to perform vaccine orders. So we've kind of already gone down that path as well. But in addition to that, counties that have available vaccines, once these things are in place, let's say Montgomery County or Schenectady County, once they have the vaccines, what they can then do is request these ambulance services to go out to rural areas and begin distributing the vaccine. They can make that request when they start getting those, when they start identifying the areas where they're needed. One model being used is that the county actually to pay for the services, and then the county can actually seek reimbursements themselves from the federal government, rather than the ambulance service generating the individual invoices, which tend to be more difficult in the past, just to make it easier for this process to roll out.
Now, only 7% of the state actually completely vaccinated. What would you say to your constituents at this point? The ones who are worried and are frustrated with the lack of distribution at this point.
Well, I think that my hope is that the supply lines will increase. I know there's a new vaccine that just came out, Johnson & Johnson, which is one dose, I believe, which makes things a lot easier as well. So not only will there be more vaccine suppliers, but hopefully we will see more vaccines actually being distributed to these areas, and then putting things in place to be able to reach those people as well. It's very critical that we start thinking about these things ahead of time. I'm going to be talking to the governor's office about this. I'm going to be talking to the Department of Health to get a plan in place, and also let people know that this is an option. Let the counties know that they can participate in this. And in some areas, honestly, in these rural areas, this is the best option to be able to reach people that are just not going to be able to get to these vaccine sites. But I would encourage also the vaccine sites to, again, the Fonda Fairgrounds in Montgomery County seems to be like a great place where you can have a mass vaccine distribution site. But we have to remember, not everybody's going to be able to get there.
And of course,
If anybody needs more information about this or any of your proposals on any legislation, they can check out your Facebook page, go to your website, get in touch with your office, right?
Yes, I would encourage them to do that. There's also an option there to communicate back, send an email, or they can always contact my office as well.
Okay, great. Assemblyman, it's always so great to see you. And, we look forward to hearing more about this proposal as we move forward. So we look forward to another update soon.
Thank you. Thanks for having me on the show. Stay safe, stay healthy. Thank you so much.
you too. Thank you so much. We've been speaking with
Assemblyman Angelo Santabarbara, who represents the 111th Assembly District, all of Montgomery County, and parts of Albany and Schenectady counties. Thanks for joining us. We'll see you next time.